Okay, hi, my name is Valley. I'm going to be doing a blood transfusion pass off, so I'll start. Okay, so the first thing I'm going to do is I'm going to look through all the orders. We have a blood transfusion for Richard Jones. It is for a GI bleed, and yeah, I'm looking at consent, making sure everything's right. Looks good. Okay, I'm going to go into the patient's room, do hand hygiene as well. Okay. Knock, knock, provide privacy. Hi, Mr. Darius Hassan. My name is Valley, and I'll be your nurse today. So I'm just going to make sure, I'm just going to hurry and check your ID band. Yep, your birthday and your name. Okay, perfect. So what we're going to be doing today is we're going to be giving you some packed red blood cells for a GI bleed. This is, the doctor said he went over this with you, but this is just to keep you healthy and make sure you don't lose too much blood. It'll be good. I have right here that you signed everything. Does that look right? Yeah? Okay, perfect. Alrighty, so I'm just gonna make sure I have everything. I'm gonna start with a baseline set of vitals. If I would have had any medications, I would have gave it 30 minutes before the procedure. So we're gonna just go, oops. I'm gonna get some vitals. So we're gonna get a baseline set. It's good. Okay, and then I'm gonna do hand hygiene. I'm just gonna get everything ready, so I'll get both. And I will come over. And we're just gonna assess the patient before we start. I'm gonna be looking for JVD, any problems, anything. I'm gonna look for fluid overload. I'll check the lungs, the heart, and everything. And then I'm gonna look for edema. I'm also gonna check out this IV site to start. Looks good. No redness, nothing like that. Okay, we're gonna hurry and check this. No edema or anything. Everything looks good. Fix this all up again. Okay, and then no JVD. Okay. Now I'm just gonna hurry and check this. Are you okay? Okay, I'm just gonna have you lean forward for me. Perfect, thank you. Okay, everything sounds good. I don't hear anything abnormal, so we're just gonna kind of go over there and get everything ready. So when I go in, I'm gonna make sure that his IV is patent and we can get some normal saline through. While I do that, I'm gonna explain the procedure to the patient a little bit better, and then we are just gonna talk about signs and symptoms. Okay, alrighty, hi, I'm back. So I'm just gonna talk about some signs and symptoms if anything does happen during the transfusion. So anything abnormal, you're just feeling a little funny, let me know. But so itching, a headache, nausea, anything that like a rash or anything, just let me know and we'll stop the transfusion immediately. Just need to know this. Okay, we're just gonna make sure I take. Oh, I forgot. Remember. Go the hub for 10 seconds. Okay. Oops. Sure it's on there. Really good, apparently. Okay. I'm just gonna make sure it flushes. It's open. Okay. Flush. Everything's flushing really good. I'm just gonna leave that connected for 2 seconds. Okay, and I am just gonna get my line ready. All right, I'm gonna put on another pair of gloves. These are really clean, apparently. My hands are clean. Correct. Okay. So I'm gonna put on some gloves and we're gonna get the IV line ready with normal saline to start with. Okay. Just gonna bring this over here. It's a little easier. I'm just gonna get everything ready. Whoops, pick that up later. Okay. Now I'm just gonna make sure I get everything ready. I'm going to make sure I have all of these closed. Don't spill blood anywhere. closed, that one's closed. Okay, and then this one also closed. Okay. Just make sure. Okay, perfect. I'm gonna set this right here. And I am going to switch this back. This is just normal saline, by the way. So we are aware and everything. Okay. So I'm just gonna hang this up. Awesome. And then I am going, okay. Okay, now, before we do anything, I'm gonna sleeve that one. And I'm gonna let this down. So I wanna get it in this, I wanna fill up the past the filter. Eventually, we'll get there. There we go. Okay, so we're just gonna make sure we're filled up past the filter and everything. Okay, there we go. Okay, now I'm gonna keep that liquid. And I'm gonna get my line. And I am going to make sure, oh my gosh, that I prime the line. I'm just gonna watch the line. So let me prime, make sure there's no bubbles. Okay. Okay, it's primed. Now I will get this, and since I left it on there, it's still sterile and everything. Get this, make sure it's completely primed. This off, right there. And I will connect this to this. Oh my gosh. Okay, if I were to touch my finger in that, I would get a alcohol swab and not to touch anything else. Okay, I'm gonna fill it out this. We're gonna do hand hygiene. Okay, I'm gonna go to the blood bank and we are going to make sure that the blood is right. Okay. I had a second nurse with me. She's just gonna verify that the blood is right. So there's the blood. Get up. Okay. So patient is Darius Hassan. Darius Hassan. The medical record number is 982541367.
982541367.
Okay, and then we just know that the blood is a positive.
Yep,
and
positive.
We are giving him O negative blood, which will be compatible. Antibody screams negative. Cross match compatibility compatible. And just some comments, patient has no identified antibodies. Blood bank has confirmed compatibility for A+ packed red blood cells. No known history of transfusion reactions. So, okay, I'm gonna hurry and put on some gloves and then go to blood. Thank you. Awesome, okay, now I'm just gonna come back over here, and now I'm just gonna spike the blood back. Make sure to, I'm actually just gonna get, I'm gonna put this over here. Anything that touches blood, I will put in the blood bag when I have it. Okay. I'm gonna make sure my lines are all locked before I even spike it. Okay, so everything's good. This off. Spike back. Okay, that's spiked. Not spilling anywhere, thank goodness. I'm gonna add that on. Okay, I'm going to make sure that the blood is going to, I'm gonna open this and I'm gonna make sure that the blood will go into the, oh my gosh, will go into this little tubing here. I'm just want to make sure it goes in good. Everything is good in here. Very slowly, apparently. Okay, there we go. As you can see, it's all good. Okay, we're gonna measure the blood. Looks good. Okay, remember, if you're feeling any kind of reactions, you just let me know. And we will stop the IV transfusion immediately. We're gonna do this at 2 mLs per minute for the first 15 minutes. And then after that, we will just do it at the rate it's prescribed. After I took the blood out of the blood bank, we will make sure that it's to him in 30 minutes. And then we will only do the transfusion for the max of 4 hours, but it's prescribed. I will let you know when the transfusion starts and when the blood gets there. Transfusion starts now at 11:15. Okay, for the sake of time, we are not going to do the entire transfusion, but I would have a bag of normal saline and normal saline tubing. If any reactions went wrong, I would get all of this tubing, all of the bags, and put it in a bag and send it back to the blood bank. I'd make sure I got a patent IV and that we got the normal saline hooked up and flushed it, and then I would contact the provider. So now I'll just make sure that everything went good in our case, luckily. We've already got all of this and put this in our gift bag. Okay. Oops. I'll have this in here. Okay. Awesome. I would take vitals as soon as the transfusion started. As soon as the transfusion started, an hour into it, and then at the end, and then we would keep them after to make sure that there's no side effects or anything. We would, I think, do it 15 minutes hour and then an hour after. We'll teach them about any like side effects they could have like after the transfusion. It can happen from days to months after, and then we will just check up on them and let them know when to come into the doctor. And that's good.